Nursing Reviews again, where we review nursing topics in 5 minutes or less. Today we are talking about venous insufficiency, which is also called a chronic venous insufficiency or CVI. This is basically a chronic condition where blood cannot return to the heart. This is typically due to venous valve dysfunction. So just like your heart, you also have valves in your veins that are supposed to pump blood back to the heart so it can circulate again. But in CVI, you are going to have a dysfunction of these valves, which causes the blood pooling, increases in venous pressure, and that results in impaired circulation because that blood is not making it back to the heart. This results in what's called retrograde blood flow, or basically reverse blood flow, where the blood is pooling in the typically the extremities, normally the legs, and this can cause tissue damage over time because of those increased pressures. It can also lead to structural changes in the vein wall, like reduced elasticity, the chronic inflammation, remodeling, things of that nature. Of course, things that are going to increase risk, age is a big one, obesity, prolonged sitting or standing because those muscle pumps and valves are not getting worked appropriately. Pregnancy, just because of increased volume status with pregnancy. History of a DVT or varicose veins, those are all going to put the patient at an increased risk for this venous blood reflux. So you're typically going to see on an examination leg swelling. They'll say that their legs feel heavy, they ache. Sometimes you'll get a hyperpigmentation. Varicose veins, again, seeing those superficial veins just trying to hold all that blood in the legs. And in more advanced cases, you can see those venous stasis ulcers. Those are going to be weeping, wet ulcers as compared to arterial ulcers, which we'll talk about later. These are often difficult to heal, very painful. Oftentimes, the wound care nurses are going to be seeing these patients, and they have treatments that they can help them with. The diagnosis is pretty much subjective from the patient, and it also is done by just examining the lower extremities. You can do a duplex ultrasound, which is going to confirm the venous reflux, also rule out things like blood clots or some other sort of obstruction of the blood flow, and that helps kind of guide treatment based on those findings. Management, the mainstay, is really compression and leg elevation. So that's where we see the compression stockings on our older patients. We ask them to elevate the legs above the level of the heart to get that blood to flow back. Exercise and weight management, of course, will help. If your patient is sedentary, they're sitting all day, we need them to get up and move. If your patient is up all day, moving around, we need them to kind of sit and elevate those legs. So whichever end of the spectrum the patient is on, we want to encourage the opposite action to help kind of get that blood flowing back to the heart. In more severe cases where those conservative therapies don't work, we can do things like medications. Vascular surgery is typically the specialty doing procedures like ablations or sclerotherapy. And you even can do surgery in some advanced cases to help support those valves to push that blood back to the heart. But most people do respond to compression therapy and the leg elevation and exercising and those conservative treatments. Now, we mentioned before, the ulcers are kind of a complication with a little bit more severe disease. You can also have the chronic pain and skin changes just from those legs being so full of blood for so long. So sometimes you do see that. And it really can impact the quality of life significantly for these patients. So we really want to be thorough when we're doing assessments. And if you see that the legs do appear swollen, just ask them about it. You know, are these legs typically look like this, or are they puffed up? To try and catch those things early and try and prevent some of these complications.